One.
Good afternoon, students. This is Sri Ram, Assistant Professor from Department of Pharmacology. From today, we are going to discuss about the topic of elements of good pharmacy practice, okay, and the role of pharmacist in good pharmacy practice, okay. From today, we are going to discuss about this topic, okay. First of all, what are the elements? Okay, first we are doing what is means elements, okay. Next, we are saying a role of pharmacist in good pharmacy practice, okay. First of all, elements of GPP, okay. Elements of from the topic of good pharmacy practice, shortly we call as a GPP, okay, in the hospital pharmacy sectors, okay. First, what are the elements are established in the good pharmacy practice, okay. First one is advanced activities related to the good health promotion, okay. Advanced activities in good health promotions and disease related promotions and active disease prevention and attaining health related goals, okay. First of all, activities are related, okay. Activities are related and involved in the hospital sites and develop some promotions, okay. In terms of develop some promotions and related to the patients, okay. Next, disease related disease prevention, okay. And if the patient can cause a disease means how the patient can adapt in the hospitals and how they prevent, okay. How they are prevent some type of the disease, okay. This is a disease prevention, okay. And attaining health related goals, okay. And attaining health related goals means the person can attain some futuristic goals, okay. It's called as health related goals, okay. Next, activities are related to use or disposing of drugs, okay. Activities are related to use and disposing of drugs and equipments for drug administration. These products carried out in a pharmacy, hospitals, etc. Okay. The activities are related to the dispensing of drugs, okay. For example, if the person can buy a tablets, the pharmacist can obey and respond to for the position of the pharmacist, okay. Take the disposing of the tablets or otherwise the medicines, tablets or medicines or any syrups or etc. Dispose it to the patients, okay. Dispose it to the patients and the drugs are drug equipments and drug administration, okay. And some of the equipments are not available in outside, okay. Outside means the patient can easily taken from the easily caught from the hospital sectors, okay. It's mainly carried out in the pharmacy, hospital pharmacy, etc. So, okay. Next one is activities are related to self-care, okay. Activities are related to self-care like counseling and provision of medications or other treatments, okay. The activities are related to the self-care, okay. The activities are related to some persons are, okay. Some person can take some self-care related activities, okay. Some of the person likewise the pharmacist or otherwise the technicians, okay. Otherwise nurses can take the charges and involve to the patients, okay, to cure some type of the disease, or disorder to the patients, okay. And otherwise the self-care is it's a most the self-care is another than not important to the any other patients, okay. The self-care is for example, if the patient can cause up by the fever means if the patient can take some type of drugs like paracetamol, okay. If the temperature highly rise means they go and meet the doctor, okay. They go and meet some doctor, okay. They go and meet the doctors and they cure and they give some tablets to prevent some type of health activities from patients, okay. Next, and counseling and provision for the medications and other treatments, okay. The counseling and other extract the counseling, okay. The counseling is the most important from both of us, okay. Both of us like pharmacist to patients or otherwise patient to pharmacist, okay. It's the most important to the connect between both of us, okay. It's the most important. Activities are related to the pharmacy practice, okay. Next, activities are influencing prescription and medications, right. The activities are related to influence of prescription, okay. Influencing of prescription and medication. Prescription wise it's the most important, okay. Prescription wise prescription is the pharmacy practice and the pharmacy development is the most important for our career wise are also the medicine wise also it's the most important for our future, okay. Next, along with the 4 elements, okay. Next we're continuing with the topic along with the 4 elements. We are seeing like first one is reducing drug consumption, okay. First one is reducing drug consumption and emissions, okay. For example, if the patient can cause up with some disease means they can reduce some like alcohol, some alcohols, another ways alcohol smoking, cigarette smoking, etc. Okay, and other way these are also next to misuse. Okay, and the patient can cause some type of disease. They suggest some type of tablets. Okay, it is not possible to cure them. Okay, it is not possible to cure them. Okay, it's these are also one type of misuse behavior for our side. Okay, next one is export evaluation of drugs. Okay, export evaluation of drugs and other health related products advertisements. Export evaluation of drugs. Okay, in some of the hospital sites they export some of the evaluation of drugs to the patients. Okay, next one is distribution of drugs and the distribution of analysis data regarding drugs. Okay, so some of the few hospitals are otherwise large hospitals. The classification of hospitals, large hospitals, small hospitals, and medium size of hospitals. Okay, from a large hospital means they collect some analysis data from the patients. Okay, from the patient history and also etc. Okay, patient history etc. were used for our upcoming futures. Okay, next it's a participation in every stages of clinical trials. Okay, participation in every stages of clinical trials. Okay, clinical trials it is also the most important. Okay, it is also the most important for our future. Okay, the phase 1 the phase 1, phase 2, phase 3 and phase 4. Okay, these are also the clinical future estimated in good pharmaceutical practice. Okay, next what are the role of pharmacists? Okay, role of pharmacists in GPP. Okay, what are the role of pharmacists taken from the good pharmaceutical practice? Okay, first one is the pharmacist should consider the professional practice. The pharmacist should consider the professional practice on the base of the pharmaceutical practice. Okay, the pharmacist should consider the professional practice. Okay, professional practice means it's like a consider it's taken as a consider for cure for treat or suggest some type of treat some patients. Okay, it's like a professional practice on the base of the pharmaceutical practice. Okay, next should give advice while making decision about drug use. Okay, should give advice. They give some advice to the patients. Okay, they give some advice to the patients. For example, the patient can take the medicines. Take the medicine means you can take the medicine for morning and you can take the before or afternoon. Okay, likewise the pharmacist otherwise the technician can involve and say some response activities to the patients. Okay, and they should maintain ongoing engagement with other healthcare providers, especially doctors. Okay, they should maintain engaging methods. Okay, they also involved to engaging maintaining activities from our hospital sites. Okay, this is a main important. Next one is should view one another under as a co-workers. Co-workers who are working together to improve pharmacy services. Okay, so the main one from the sector of the hospital pharmacy, from the section of the hospital pharmacy, the co-sector people like none other than pharmacy like pharmacists like technicians. Okay, technicians, lab technicians, radiologists, okay, cardiologists, and anesthesia. Okay, nurses. These are also the co-workers on these persons. These few people are connect and usually connect and help with the both of us. Okay, help with the both of us. The medicine can take from our side also that both of our sides. Okay, next one is the enhancement of quality in produce organization and good practice. Okay, the enhancement of quality in a produce organization. Okay, for example, from some of the hospitals can involve some type of can involve to take some organization and organization or otherwise development activities from a patient side. Okay, this is from the practice like we should take some involved to the patients and give practice to the patients as well as pharmacist. Okay, that's all. Okay, that's all about the topic of elements of good pharmacy practice and the role of pharmacist in the GPP. Okay, thank you.